Hey everybody, welcome to my channel. I am Dr. KERRY-ANNE Perkins, a board certified OBGYN, and today we're talking about what if you have chlamydia in pregnancy. This is really an important topic to talk about because chlamydia in pregnancy can really cause complications to you, your unborn child, and your child when they are a newborn. And so we want to be aware of these symptoms and possibilities so that we can be able to take care of our bodies and our babies the best way we can. We'll talk about what is chlamydia, how does chlamydia entirely affect the pregnancy, and how to treat the unborn child if you do have a chlamydia infection. So what is chlamydia? Chlamydia is a sexually transmitted infection. It is caused by a bacterium, which is a bacteria that can be transmitted from person to person, whether it be from genital contact in the form of a vaginal intercourse or penetration, anal sex, oral sex, even manual contact from an organ that is infected to another organ can transmit chlamydia. Chlamydia can be dangerous because research has shown that as soon as it hits your system, it can start to spread and cause internal permanent damage in the form of scar tissue, further infections. It can distort the functionality of your organs. It can just do a lot. And so to help to prevent this, the recommendation is as soon as you know, meaning that you've been tested and a test has shown positive for chlamydia, that you get treatment right away, complete that treatment, and clear that infection altogether. Now, chlamydia is quite common, affecting in the last few years from the most recent data that's been released in the United States alone, over 1.7 million people have had chlamydia in the past years, and that number is uptrending. And so there's definitely room for us to be able to reduce that, to protect ourselves, and to institute things that will help to protect our bodies, and of course, to get the appropriate treatment. So what are the symptoms of a chlamydia infection? None. A majority of people will have no changes to their body that they can identify to say, hey, maybe I have an infection, maybe I have a problem down there. Not at all. Chlamydia infections can go unnoticed and can be silenced in the background. And so unless you have testing for, specifically going to your providers and requesting an STI panel to be tested, you will not know. And so because of that, it is highly recommended, especially if you are in the age category where we tend to see a high prevalence of chlamydia, which is somewhere between 16 and the age of 24, that every single year, even sometimes twice yearly, it might be beneficial just to get a full STI panel so that you can know if you have chlamydia. This panel also covers for gonorrhea, hepatitis, syphilis, and HIV. So all important things, and many of those, again, are asymptomatic, so you will not know until you complete a full panel of testing to find out. Now, is that the same for those who are pregnant? Yes. Pregnant females, even though you tend to be a little bit more vulnerable or more susceptible to infections in general, you'll still be asymptomatic when it comes to chlamydia infections. And because of that, in most states and areas, it is actually recommended in your prenatal care and treatment that you have at least one chlamydia testing with gonorrhea as well, especially in the earlier parts of pregnancy. The reason is, even though you don't have symptoms of the infection in your pregnancy can cause a lot of complications, such as the first risk to your pregnancy is having preterm labor. Preterm labor means that you have not gotten to 37 weeks of pregnancy, which means you're in a preterm state, and you may start to show signs and symptoms of laboring. That means you're having contractions that are becoming more regular, contractions that are getting harder, contractions that are not going away. Labor can lead to delivery. And so preterm delivery can put your newborn or your neonate at risk for having a lot of complications, problems with breathing, adjusting outside of the womb too early, having problems with feeding, infections. There's so many different things that can happen with an NICU admission, all things that we don't want. And so that is one big risk factor to having chlamydia that is untreated. Secondly, you may experience premature rupture of membranes. Also means that your water may break. This is what we commonly would say. When your water breaks, essentially you no longer are providing that protection that is important for your neonate to continue in pregnancy, to continue growing and thriving, because now your baby is exposed to the world, including the chlamydia that is present in your system. So we don't want this to happen. This would be dangerous. This is bad. And this will indicate or lead to you having an early delivery as well. Lastly, having a history of chlamydia in pregnancy may lead to your baby not growing well. That means that your baby has a growth restriction or a low birth weight. Now, you may think, hey, this is okay, right? I have a baby, baby's being born, baby's okay, just a little bit smaller, but that's not the case. We've seen that babies who are smaller, actually, they don't function as well. They don't recover as well, especially if they're preterm. They don't do as well as a baby that is a healthy size, average weight, or those that are larger. And so they are worrisome. We are concerned about these babies. And so we don't want your baby to fall in that category because it could be dangerous for them. And sometimes it may indicate that we need to deliver earlier than we want to. Overall, these complications are not good for babies. You may not have symptoms. You may feel completely okay, but your babies may be the ones to suffer, be admitted to the NICU, need long treatments with antibiotics, and a lot of support, which are all preventable. So if you're pregnant, we want you to get tested. We want you to get cured if you are positive for chlamydia. And we absolutely want you to get a test of cure. This is the only time that we are mandating that you get a test after the treatment to be 100% sure that this infection has been cleared from your system. So don't forget to go back to your provider and have them retest just to make sure there's no more chlamydia in your system. And with that, you also want to make sure that your partner gets treated as well, because you can always reinfect each other. If you get your treatment, your partner doesn't get treatment, you have sexual contact again, and then you transmit the bacterium to your body again. Now you need even more treatment because that infection just keeps getting passed from person to person. So it's very important to stay away from any kind of sexual contact, any kind of sexual activity until both of you have completed that antibiotic course completely 7 days after, and then you can begin to share and to be intimate with each other again. And I will put a little pin in there to also say that if you are not in a monogamous relationship, any other person who may also have chlamydia that is in this sexual relationship should also be treated as well. Another way that newborns or your child may be affected at birth would be as your baby passes through the vaginal canal. Babies can pick up on this infection on their way out the canal, and this infection oftentimes can affect their eyes to the degree that they can become blind later on in life because they were exposed to chlamydia. And even if that exposure was just for a brief time while passing through the canal, it could be significant enough to really permanently change their vision in the future. And so this is a reason why ointments such as erythromycin is often given at the point of delivery or shortly after to newborns to help to protect them from the unknown, the things that could potentially affect their eyes. And so it's a good idea often to do that. But if we know that you don't have this infection, you've been recently tested, then it's completely okay for you to skip and opt out of getting this treatment for your child. So how do you get treated for chlamydia in pregnancy? Well, you get a one-time dose of a medicine or antibiotic called azithromycin. It works really, really well. It's well tolerated. Once you get this one dose of azithromycin, it just completely cures your infection, gets rid of the chlamydia. You can be quite reassured that once you get that test of cure, that you should be cleared completely as long as you refrain from sexual activity and contact with the bacterium or anyone with it, as well as completing your antibiotic course altogether. Listen, I would love to dive in a little bit deeper with you about our bodies and changes that are occurring and how to best take care of it. And one way that I'd like to do that with you today is I want to offer you a free copy of my ebook, Hormones Don't Lie. I'm super excited about this because in this ebook, we talk so much more about our female hormones and changes in our bodies and how to make it so much better, help our bodies thrive. And so if you'd like to get a copy of that free ebook, go ahead and click the link right below this video video. I hope you've learned today. I'm excited that we're sharing this kind of information because the more we talk about the changes that our bodies go through, the more we're able to, as a community, stand stronger together and make things better so we can decrease the likelihood of having complications as the one I just talked about. Thanks for being here. I'm Dr. Perkins, a board certified OBGYN, and I hope to see you next time.